So by now you should already be aware of the fundamentals of My Health Record, such as understanding the essence of what it is, and also around the privacy, security and legislation rules, and potentially how to register. If you need to recap some of these topics, please find other short videos on WAFA's YouTube page, or navigate to the digitalhealth.gov.au website. So let's discuss some of the clinical applications. So on the left-hand side of the screen, you will note a list of some of the clinical tasks that are commonly undertaken on any given day. It may be medication reconciliation, taking resident history or conducting an assessment, requesting tests or scans, and discussion around end-of-life care. On the right-hand side, however, you will note how My Health Record can support clinical staff with actually sourcing that information. For example, medication and allergies information can be accessed via the Consolidated Medicines View. This provides key information that can help facilitate medication reconciliation tasks. We know that this in turn plays an important role in reducing potential medication errors, and I will explain how this is so. During an admission, to provide person-centered clinical care, it is a requirement to gain access to a resident's medical history. For example, access to clinical data held within a shared health summary can help facilitate completion of any assessments needed for aged care staff. It saves them time having to collect the necessary information or having to rely on a resident's inability to be able to recall medical history accurately. Another time-saving measure is when a clinician requests a particular test or scan for the resident, and you as the admitting nurse may well have already have a sense that it has already been done, but you don't actually have any proof. This information could have been passed anecdotally via a family member, or you may have seen a test result but can't place your hands on it right now. So it's a good use of My Health Record to see whether that test has already been recorded. Also, within My Health Record, you can check the pathology and diagnostic imaging view to see whether this test has already been done, and this function helps eliminate the need for duplication of tests, which historically has resulted in a waste of resources and time. When considering end-of-life decisions, which is a big conversation that is held within this space, you will note here that residents, in fact, all consumers do have the capacity to upload their Advanced Care Directive. They just need to download it as a PDF and then upload it to My Health Record. This is then accessible by all healthcare providers responsible for that particular individual during end-of-life or palliative end-stage care. So remember, historically, information about your healthcare journey was held individually within each healthcare service that you would visit, whether this be a GP or a specialist or a pathologist. Now, a key piece of your health information from each health service are collated into the one place, thus minimising the challenge of sourcing all the information within a timely manner. My Health Record is not designed to replace other sources of information available to you, but rather to enhance visibility of the information available to you. So join us now for a short video around the challenges associated with obtaining information during an admission.
Older people are really surprised that the systems don't talk to each other. There's also an assumption that we can access their history, their health information, that systems do talk to each other and that we all share comfortably. That really hasn't been the case as easily as it is now with the My Health Records. We can have access to things like vaccinations. Influenza vaccine has become an incredibly important protective thing for people who are ageing and living in residential aged care and in the community. So, having that sort of immunisation record, having access to pathology, and having access not just to a list of medications that have been ordered, but to actually be able to see those that have been dispensed. It doesn't tell us if the medication has been taken, but it's another part of the picture that we can see that medication that was ordered has been dispensed, and then we can speak to the person themselves about whether they've taken it and how they're finding their medication. people are wanting to stay at home, and the My Health record will follow them and be there in the background wherever they may go, be it relocating to another state, be it travelling on holidays, intrastate or interstate within Australia. The My Health record goes with them. And then in those health bumps, those times when we do need to touch the public health system, perhaps with an admission to a hospital or the private health system, or day surgery, older people are going to be staying in the community longer, and this record is going to follow them and really address those concerns around, why don't you know my history?